What is up, YouTube watchers? My name is JT, and I have multiple sclerosis. I will be having surgery in 5 days for cervical spinal stenosis. So we're going to be watching a video about what exactly cervical spinal stenosis is. Now, this video is going to be explaining exactly what cervical spinal stenosis is.
This picture is an MRI of the neck, and we're looking in from a side view. So to get you oriented, this would be the front of the neck, this would be the back of the neck. You can see the tongue and the chin would be here. The bottom of the brain is right here, so this would be up and this would be down. And again, we're looking in from the side. Now, there's 7 bones of the cervical spine. The first bone is this little white area right here, which is the smallest bone of your neck. This is the second bone, third bone, fourth bone, fifth bone, sixth bone.
Okay, mine, what I'm gonna have surgery on is the second, third, and fourth bone.
And seventh bone in your neck. And then these 2 bones down here are the first and second thoracic bones. In between the bones are the disc, which are the dark spaces between the bone. And then this gray structure here is the spinal canal. And around the spinal canal, you see this white stuff, which is spinal fluid around the spinal canal. So on this particular picture, you can see that this person has narrowing of the spinal canal at multiple levels, which is representative of severe spinal stenosis. So if you look right here, you can see the disc here is bulging backwards, and this dark stuff is ligament under the bone, which is pushing inward, and it's pinching the spinal cord right here, causing severe narrowing of the spinal canal. And so at this point, you don't see any white around the spinal cord because the spinal cord is being pinched by these 2 structures. Down at these levels, you can see there's early severe narrowing as well, but not quite as bad as up at this level here. So this is a good example of severe spinal stenosis, particularly at this level right here. This is another view on the same MRI, but this time we're looking straight down the center of the spinal canal. So to get you oriented, this would be the front of the neck, this would be the back of the neck. The gray oval structure is the spinal cord, and the white stuff around it, that white halo, is spinal fluid around the spinal cord. So again, we're looking straight down the center of the spinal canal. So you can see at a normal level like this, there's plenty of white or spinal fluid around the spinal cord. And also note that the spinal cord looks nice and oval.
That's basically what it should look like. Basically, gonna show you the uh, the brain with spinal stenosis.
That's a typical representation of a normal level in your neck. These are the same type of slices where we're looking straight down the spinal canal. So again, this is the front and this is the back. At the normal level, you can see there's a generous amount of white around the spinal cord, which represents the spinal fluid. Also remember, the spinal cord here looks nice and oval. As you come over to the level of spinal stenosis, you can immediately see that the spinal cord looks more like a boomerang. It's very flattened out, and there's minimal remaining spinal fluid around the spinal cord. So this is an example of severe spinal stenosis. As we come to the next slice here, this is where the spinal stenosis is the worst, and you can see at this level, again, the spinal cord looks more like a boomerang compared to the normal side, but also you can see that there's no spinal fluid around the spinal cord anymore. And so this is severe narrowing of the spinal canal at this level with pinching of the spinal cord.
So that is exactly where I'm at in my life right now. Okay, so now that you know what's going on with me, if you would like to join me on this MS journey and check out the results of the surgery, please subscribe and give me a like because that helps a lot. And yeah, be good or be good at it.